Yeah, so there is a saying that regulations stifle innovation, which I wholeheartedly completely disagree with. Innovation, by its definition, is the process of inventing something new and bringing new technologies to the forefront of science. What regulation does is step in after the innovation has occurred to make sure that it's safe and effective for use in the real world. And everyone would agree that in the realm of medicine, you have to make sure that patients come to no harm. And AI has massive benefits. We all agree that. It also comes with risks. The risks might not be physical risks, but they are related to data, they're related to decision-making, they're related to cybersecurity. And the innovation has already happened. The algorithm has been developed. What the regulations do is just make sure they're safe and effective before it gets to market. And we all agree that in medicine, patients should not come to harm. And with the big benefits of AI, there also come risks. And all the regulations do is ask developers to prove that the benefits outweigh the risks and that those innovations can come to market safely. So they do not stifle the act of innovation. What they do is they put a slight brake on actors trying to get to market, because some of those actors may not be as safe and effective as they believe that they are. So it's a safety net to the whole industry, and a super important one at that. So there is a geopolitical difference in regulations, especially around medical devices, between the US continent and the European continents. And we've seen this bear out over the past few years. Europe has shifted to a slightly more regulatory paradigm with the introduction of the medical device regulations, and more recently the EU AI Act, which is a more horizontal legislation that covers all AI systems, not just medical ones. Whereas America has stuck with a more fluid and centralized regulatory system for medical devices and has produced no horizontal legislation covering AI. The Biden administration hinted that there should be some kind of general AI regulation. The Trump administration is very much not tooting that horn. And in fact, we're seeing even layoffs at the FDA and the very department that reviews AI radiology medical devices. So yes, there is a tension between the two different regulatory systems. Both are there for the same purpose, to ensure that medical devices are safe and effective. The advantage that the American system has is that it's centralized, it's faster, it's cheaper. But with that also comes the risk that these devices that are getting 510K cleared, which is a predicate system, does not actually look at the downstream benefits and the direct impacts on patient care. They are largely based on retrospective data and a claim of equivalence to a predicate device in terms of performance alone. What the European CE marking system does is goes further and asks companies to demonstrate that there's a measurable, meaningful impact on patient care downstream, which is why it's harder to get a CE mark, why there are fewer medical devices with CE marks. That demonstrably they are proven to be the most safe devices on market. Now, of course, if you're an industry partner, the developer of systems, the American market is bigger, it's faster, it's cheaper, it's more attractive. But in reality, the European market is actually a more safe and more effective market. Now, I'm not saying either is perfect. There are pros and cons of both. But I come from the UK. We're kind of stuck in the middle. We're trying to find that middle ground where we can be both safe and effective, but also faster and cheaper. So regulations constantly adapt. Laws are always changing. Guidance is always being produced. So I love being at this cutting edge of the regulatory science, as it's known, and to see which way each continent will go. And the future is yet to be written in that regard. So one of the problems in our industry is because we're quite a immature, young, excitable industry, is there's a slight lack of regulatory transparency, to be honest. A lot of companies have these regulatory clearances, but it's actually quite hard to track and find the information that a purchaser actually needs to know about a medical device. Even simple things like what does the device do from a regulatory approved standpoint, known as the intended use, can be very difficult to find and track. Currently, the FDA do publish that on their database, and if you know where to look, you can find it. And it's not mandatory currently on the UTMed database, though it will in the coming months be mandatory to provide this information. The EU AI Act, for instance, does make it mandatory for all providers to provide in a digital format via a fixed URL their instructions for use. So just like when you buy a drug, you get an information leaflet about what you can and can't use the drug for, side effects, safety issues. that kind of model card, as it's known, should be available for AI systems. And I'm a big proponent of regulatory transparency. I do not like the hide and seek that some vendors tend to play with this. Your intended use should be something to be proud of, not something to hide away and keep in your own pocket.